Hello everyone, I'm Matilda van der Bosch and I'm an adjunct professor at the School of Population and Public Health and the Department of Forest and Conservation Sciences at UBC. I'm currently working as a senior researcher at the Barcelona Institute of Global Health in Spain. I'm co-leading the Greenness team within CANUE together with Paul Villenueve, and my research has mainly been related to analyzing associations between natural environments, green and blue spaces, and different health outcomes, as of late, mostly focusing on childhood health.
Hi, I'm Lorien Nesbitt. I'm an assistant professor of urban forestry at the University of British Columbia within the Faculty of Forestry. My area of research focuses on urban forestry, environmental justice, and human health.
Good morning, I'm Paul Villenueve. I'm a professor in the School of Mathematics and Statistics at Carleton University. I've been co-leading the Green team with Matilda van der Bosch over the last few years. It's been a dream team, and I've been really excited to contribute to the developments on greenness.
So welcome very much to our presentation, where we want to tell you a little bit about what we've been doing in the Greenness data team. So when we started working within the CANUE consortium, we were tasked with the exciting task to look at different green space and blue space exposures across Canada, and starting off with the normalized difference vegetation index. And then we also wanted to support activities for developing other measures of greenness, looking at accessibility, street view measures, and school-based measures, for example. We were also supposed to look at other metrics in relation to blue spaces, water environments, and another important task was to identify and develop additional funding applications.
So our work has supported the development of various different greenness data sets that CANUE now holds or that are in development. Those particularly revolve around sort of the existing data sets that are Landsat data in various with various time periods at a 30-meter resolution, MODIS data at a 250-meter resolution, and then higher resolution data sets, including PlanetScope images and rapid eye images. And there's also, given the sort of increasing interest in blue space and health, an existing data set that measures proximity to water. In the future, CANUE will be bringing in a greenness fraction data set that uses Landsat data to calculate the fraction of greenness within a pixel at a 30-meter resolution. And then there's other collaborative metrics in development, including the Green View Index, which uses Google Street View data to calculate a percentage of greenness within a perspective view from the street level instead of from the air. So providing measures of greenness across environments, and particularly in cities, from various perspectives and at various temporal and spatial resolutions. Please.
Now, an important contribution of CANUE has been to support trainees across a number of different universities. And this training has been multifaceted. It's provided training for travel. It's provided available data for analysis. It's also provided direct funding support in terms of stipends for the students as they work through the programs. And it's funded students at various levels, master's, postdoctoral, as well as undergraduate training. Now at Carleton University, I've had the pleasure of being able to supervise two groups of students. In the Masters of Health Sciences at Carleton, students work together in an interdisciplinary group to tackle a research question. So CANUE's provided funding to support two of those groups, and it also has provided funding to support a postdoc who helped organize a workshop around greenness and new metrics of greenness that we held at the University of Toronto.
Also, thanks to support from CANUE, we were able to have a guest student, Matteo Andriani from the University of Padua, who was completing part of his master thesis together with us under the supervision of myself and Lorien Nesbitt. And Lorien Nesbitt was supported through CANUE to develop her postdoctoral fellowship work, and was crucial to contributing to a lot of the metrics that have been developed.
And then just in the past year, we have started to support Kirsten Wong-Stevens with CANUE funding to develop her MSc work about urban greenness and heat. And I'll talk a bit more about that later.
The funding from CANUE has also supported these students, and here are some of the theses that have been completed with support from CANUE. At Carleton University, there were two groups of students who went through the program. The first one looked at impacts of the built environment, including the Greenview Index and the NDVI on both physical and mental health. And then the second project use CANUE measures of greenness to look at associations between physical activity and obesity in the Canadian Community Health Survey.
Right, and at UBC, as mentioned, we had Matteo Andriani, and he was working at comparing different remote sensing data sources for estimating greenness exposure and the association to surface temperature, addressing the urban heat island issue. And then Zoe Davis was taking advantage of the data collected within or stored within the CANUE database, and was particularly analyzing the impact on childhood health and development using different types of greenness metrics.
Kirsten Stevens now is undertaking an analysis of experiences of extreme heat and how those experiences are mediated or improved by urban forests and exposure to greenness, with a focus on climate justice and understanding how these experiences of extreme heat intersect with markers of marginalization, and how we can bring some of that understanding into health policy to improve climate justice across Vancouver. So we've shared our research results across various conferences that have been, I think, helpful in terms of getting the research out there, but also in receiving feedback and making this a really collaborative experience for our research team. So together with multiple authors, our research on greenness and childhood allergenic disorders was presented at the Allergen Research Conference in 2019. We also were sort of engaging and communicating our results in the urban forestry space at the International Urban Forestry Conference in 2018, and at the IACS-IACE Joint Annual Meeting in Ottawa in 2018. And then internationally, we've also shared our research at the Urban Transitions Conference in Sitges, Spain in 2018, and at the In Vivo Planetary Health Conference in Detroit in the United States.
Right, and in addition to these tangible results, we were also able to hold a very productive workshop in Toronto in the spring of 2018, where we gathered the members of the Greenness team, but also invited external experts and advisors, for example, from the MIT, where we discussed how we could potentially implement different scripts to gather more Greenness data within CANUE. And this meeting, as I said, was very productive, and it resulted in identifying and definitions of future projects ideas and how we could approach other funding venues. And we also started this collaboration with MIT, and we also developed a scoping report scanning the available data on urban greenness and tree canopy in Canada. Further on, leveraging to other projects, the Born to be Wise project, we were looking at early life exposures, environmental exposures, and the impact on childhood health and development. Was supported by CANUE in the application phase and resulted in a funded CIHR project grant.
In addition to that project, the data on greenness from CANUE really laid the foundation for a grant application that was developed by Dan Kraus to submit to CIHR. We were fortunate enough to get funding for that, and it's looking at the relationships between greenness and mental health among participants of the Canadian Longitudinal Study of Aging. And those analyses are ongoing, and we're planning to present some of the results this summer at the ISEE meeting that will be held virtually. In addition to those activities, a number of us have also participated in a number of different webinars held by people across the country. Some of those webinars have looked at, a synthesis of studies of greenness and health, and looked at the important methodological features such as residential mobility and its implication for modeling epidemiological data. In addition to those activities, CANUE data still continues to be widely used in a number of different topic areas. Here are some of the papers that have been published over the last few years. The topics have ranged from looking at relationships between greenness and walkability, active transportation, various health outcomes such as inflammatory bowel disease, mental health, and relationships with things such as air pollution and mortality.
What we've been doing also, as Paul mentioned, there have been a number of publications where we've also looked at different, for example, how exposure relates to accessibility or proximity, and then self-reported health. We've been using the CCHS, Canadian Community Health Survey, a number of publications around the topics I think we have been mentioning before: childhood health, mental health, and associations to greenness.
So we would just like to conclude to thank you for your attention and really thank the contributions of all the students and CANUE who made a lot of work possible over the last 5 years. And we're looking forward to continue to extend some of these activities over the next 5. Thank you very much.